So Timor-Leste is a small country that's half of the island of Timor. It's very poor. The population is very young, so about 50% of the population is youth under the age of 25. So they have a number of layers of vulnerability.
When I first visited Timor-Leste and I went to the districts, I can see that the health facilities is barely there. Sometimes they have the building, but they don't have the human resources. And according to the community information, the paramedic or the medical doctors is almost never be there.
The communities in Timor-Leste are very remote. The majority of people still live in quite remote areas, which means that it's very difficult to access these communities. And because of the challenges with access, the volunteers are members of the communities themselves, and they're able to help their own communities to respond to disasters if they need to, or other health risks.
To final iha dois melonsi professor Mela tama mai cria una voluntaris da professor Mela. Hare ho implementação da nível de treinamento implementa a comunidade sira. Agora sira hasesan ituang ho se bati da sawa de ona. Então ida na mitur hamoto to bahira comunidade hansan hasesan itu ona sira ha movimento de laudia.
Our vision is to improve of the quality of the vulnerable people in Timor-Leste. Most of the civil activity is delivered by our volunteers. We provide training to them, and our volunteer will provide deliver information to our community.
Palameran inian tentang amilau halo treinamento da kona ba malaria nian amilau tamasai uma anfo informação basira para siramos belhamos uma hongo de cuidado provena moras level conhecida.
One of the programs that they have been doing for the last couple of years is on community-based health and first aid. This program is looking at community health, where communities are supported to identify their own health risks, and they're supported to develop a plan to respond to those risks, so that the communities are able to be healthier and more resilient. Nutrition is another area that they've recently started to work on. It's a really key need in Timor-Leste. And they're helping communities to have a greater awareness about nutritional needs, about their food sources, so what they're growing, what nutritional needs they get from different vegetables, and how to cook, how to improve the cooking so that children are getting better nutritional needs.
Agora hane sambuat na beheta mudang situan hati to agora hau hane sa hodis persoalan pada karakter dan voluntari pasivitel. Tambah komunidade sinti buat barak mak akontesen pasira. Laos ke bahasa 1% mai 25% atau 50% ihauna. Tambah komunidade sira hasesan hosi buat tidak sawodi sira hamos siranya umahung takarai kuak benalihung pengira sira hare kalen atrod sira nemo sira hakoi tutu yertia ona. Nebe ita hare bamai buat tidak kena malaria di area ini hasesan itu ang sira ona.
Before we start the CBHF approach in the community, they never have knowledge about the health. For example, a simple example is using latrines. They never use latrines, they just go to the forest and like open defecation everywhere. But when we go to the community with this approach, CBHF approach, they change their behavior then they go to they using latrines.
Community-based health and first aid is having a participatory approach. Communities being involved since the beginning of the program. For instance, during the assessment, collecting the data, the community will come together and trying to identify their needs, and after that do the mapping and planning based on that findings.
2 years ago, we provide the program that we call integration community-based risk reduction, and we integrate 2 programs that from disaster management program and from the health program that we integrate in one package.
So having this complete package of community-based program is expected to be more effective and to be more efficient in terms of budget, in terms of human resources. Having more complete or more holistic approach definitely will help the community to be more resilient and to be a better community in the future.